Here we are going to look at some characteristic findings in case of SLE, that is systemic lupus erythematosus. So first few questions. The first one is comment on the effect on the joints. And second one, in case of the bone marrow, what is the characteristic finding? So in this video we'll find these answers. So to begin with, we are going to look at firstly we are going to mention the system and we are going to tell the characteristic findings. So first is the blood vessels. So what is the finding in case of blood vessels? So in terms of blood vessels, there is acute necrotizing, vasculitis, and this is with nothing but a fibrinoid necrosis. This is nothing but with a fibrinoid necrosis. So next we have the kidney. We are looking at the kidney. So what is specific in kidneys? In kidneys, there's a wire loop lesions. There's presence of the wire loop lesions, and there is also the tubulo-intestinal lesions. There is tubulo-interstitial lesions. So let's just recap. So we saw that we'll be discussing the system along with the clinical features. So first one we saw is the blood vessels. Blood vessels, there is a acute necrotizing vasculitis, and this is with a fibrinoid necrosis. And then we also look at the kidney. Kidney, if you see, it has a wire loop lesions as well as the tubulo-interstitial lesions. Next we are going to do the skin. So what happens in the skin? So in terms of the skin, there is a vacuolar degeneration. There is a vacuolar degeneration, and this is of the basal layer. This is of the basal layer and of the epidermis. Basal layer of the epidermis, as well as there is vasculitis. There is vasculitis, and this is with the fibrinoid necrosis. Fibrinoid necrosis. Next we also look at the joints. So what is this joints? The joints, it has a non-erosive arthritis. So in case of the CVS, there is a cardiovascular system. What is specific? There is a fibrous pericarditis, as well as there is Liebman sac endocarditis. The Liebman sac endocarditis. So let's just recap. So we saw the skin. The skin, it has a vacuolar degeneration of the basal layer, that is of the epidermis. There is also vasculitis with the fibrinoid necrosis. In terms of joints, there is a non-erosive arthritis. Next, when we look at the CVS, there is a fibrous pericarditis as well as there is Liebman sac endocarditis. Next, we'll move on to the spleen. So what is specific of the spleen in case of SLE? In case of the spleen, there is splenomegaly. There is splenomegaly, as well as there is capsular thickening. And there is also the follicular hyperplasia. There is follicular hyperplasia, as well as the onion skin lesions of the arteries. Next, when we look at the lungs, it has the presence of pleuritis. So there is pleuritis. There is also the pleural effusion. Next comes the chronic interstitial fibrosis as well. There is the chronic interstitial fibrosis, as well as the secondary. There is secondary pulmonary hypertension. There is a secondary pulmonary hypertension. Now let's recap. So here we saw the spleen. So in terms of the spleen, there is presence of the splenomegaly. There can be capsular thickening. There is also the follicular hyperplasia. There is presence of the onion skin lesion of the arteries. So in terms when you look at the lungs, there is pleuritis, there is pleural effusion as well. There is also the chronic interstitial fibrosis as well as the secondary pulmonary hypertension. Next we'll move on to the bone. So what is specific in terms of the bone? So there is bone marrow. So in terms of bone marrow, there it includes the hematoxylin bodies, and then we also look at the LN, that is the lymph nodes. So lymph node, it includes the lymph adenopathy, and this is with the hyperplastic follicles, as well as there is the necrotizing lymphadenitis. There is the necrotizing lymphadenitis. Now let's just recap what we did here. We saw the presence of bone marrow. In terms of bone marrow, there is the hematoxylin bodies. In terms of the lymph node, there is the lymphadenopathy as well as the hyperplastic follicles. There is also the necrotizing lymphadenitis. Now let us answer our questions. So the first question we asked was in terms of the bone, in terms of the joints. First one we asked was in terms of joints, what is the finding? So in terms of joints, there is a non-erosive arthritis. Next we asked was in terms of bone marrow, what is it? So in terms of bone marrow, we find that there is a hematoxylin bodies. So to repeat, we saw the joints with non-erosive arthritis and the bone marrow with the hematoxylin bodies. So this was about the characteristic findings in SLE. To learn and grow daily, please do subscribe.